Thank you very much, Mr. Chairman, for holding the hearing. It's great to see you, Secretary Becerra. I know we have a short time, so I'll jump right into it. Last week, you and I spoke at the Nevada Health Center in my district about the bipartisan cancer moonshot initiative, and I want to thank you and the administration for including that in the budget. This is a very important initiative to all Americans to beat cancer once and for all. One of my concerns is inequitable access to preventative services, cures, and treatments for communities of color who have historically faced access barriers across the board, especially for those in rural parts of my district. So can you just share a little bit about the budget and how this will work to address some of these issues?
I'm sorry, Congressman, in what part of the budget?
On the prevention to access for cancer.
As I've been saying throughout this hearing, we are going to try to do what we can to help when it comes to cancer, because it's not just a matter of trying to find a cure. It's trying to prevent Americans from getting to the point where they have no choice but to pray for a cure. And we know from our recent experiences with COVID that a lot of Americans missed out on one of the principal elements of prevention, which is the screening that has to occur. So one of the things that we're going to double down on is making sure all those Americans, some 9 to 10 million we estimate, missed out on their screening visits, that we get back into the habit of routinely going in for those screenings so we can detect any cancer before it gets to the point where we can't do anything about it.
Thank you, and I look forward to working with you. I know there's some new technologies and advancement out there that can also help, from blood tests to other types of screening that can also help with this. Secretary Becerra, I wanted to just touch on HRSA funding briefly, the uninsured program that helped some 300,000 uninsured in Nevada. Are there other sustainable sources of funding that can be used to help cover the cost of COVID-19 tests, treatment, and vaccines for the uninsured? And what can we do in the meantime until this funding is restored? And additionally, how are you working to otherwise reduce the number of uninsured and increase enrollment in the ACA exchanges to get more people into affordable coverage?
Congressman, as we've mentioned, we're going to do everything we can to make sure that we continue to provide services to the uninsured and to help providers who are actually doing the right thing by providing services to the uninsured. The Provider Relief Fund monies that we made available and kept as long as we could to provide reimbursement for testing and treatment, and the longest period of time for vaccinations, has now essentially closed its doors to be able to reimburse providers. We hope that Congress will provide us with additional resources there so we can re-up the program. But short of that, we'll continue to work with states. For example, we're working with them to make sure that anyone who is not accessing care today or has access to care, today under the Medicaid program, but may lose it as we wind down the public health emergency and a number of people would drop, that we find everything possible to see if they qualify for the Affordable Care Act, marketplace coverage, or perhaps even within the Medicaid program, so long as we update their data.
Thank you. I know I'm out of time, Mr. Chairman. I just wanted to touch on the community health centers. I know that there's $90 million increase for health centers, but also includes a reference for the second year, and want to work with you and the administration to ensure that we are adequately funding these health centers, which have been at the forefront of addressing the COVID-19 pandemic and other health-related issues. So thank you, Mr. Secretary, for your leadership, to all of those serving at HHS for their service. We appreciate your leadership.
And you mentioned the health centers, which is another way to make sure we get to those who might otherwise be uninsured.